Okay, let's see. And looks like we are live. Thank you, everyone, for joining us today. This is Dr. Koba with Louisiana Center for Eyes. And today I have a special treat for everyone. I have a physician colleague here that I am bringing on to kind of talk about topics that relates to the eye as we have our eye health conversations. And so this is my first guest on our platform, and I'm so excited to have her. This is Dr. Ruth Reed Thornton. She is a medical doctor. She is the founder and medical director of Chronic Pain Rescue. She is board certified in physical medicine and rehabilitation, as well as holistic and integrative medicine. And she helps patients with injuries and those who have complications of diseases through a wide range of treatments and rehab techniques. And so I'm excited to have her. And so I'm going to let her introduce herself a little bit more for us. Hi, Dr. Ruth. Thank you for coming on.
Oh, thank you so very much for having me, Dr. Koba. This is really exciting. I'm excited to be here and speak with your audience. I'm really privileged to be here. I'm a physiatrist, physical medicine rehab specialist, and I've been practicing for more than 20 years. But I do feel there is a need for people who with chronic pain to have a place that they can really go where their needs are really addressed. I think too many people are kind of just told, oh, you just have to live with it, or they don't have hope, when there are actually interventions. And we know so much about why chronic pain happens, and it needs to be more universally addressed and better addressed. So that's what I've created with Chronic Pain Rescue. We're not yet launching by the end of the month. There'll be an online health coaching practice. So,
yeah, I really, like I was saying before we hop on, I really love what you're doing because chronic pain is such an issue, and it could be a variety of causes, and a lot of people have already gone through, seen many doctors, right? And have tried so many different things. And I love the idea of having a coach, somebody who's helping you walk through that, and to help you, get to the other side, or find a way to kind of help you deal with your situation in a way.
yeah.
And so tell us a little bit more about the whole coaching aspect of chronic pain, and how does that look like? And a lot of people are not really familiar with coaching,
Yes.
and maybe describe a little bit of some of the types of chronic pain that you've come across that different people deal with, and from that aspect.
Right. So that's a good question. What is coaching like? I think, to be honest, probably we as doctors, especially if you're one that teaches your clients, your patients, we kind of have that in our DNA. If that's the type of doctor you are. I know there's some doctors that's just do what I say, and that's not really a partner. But a coach is someone who will come alongside, discuss what your goals are, discuss what are the things that we need to do to help you achieve those goals. Because it's more, chronic pain is so over involving. I mean, it really does take over people's lives.
Yeah.
And how to get their lives back. That's what we really want. We don't want to just say take care of pain. We want to help them to function at home. We want them, if they want to return to work, how to be able to do that, how to take care of their kids, and how to be able to play with their grandkids again. That it's about life. It's about restoring their ability to get back to life. And it's funny, a lot of people don't make that connection, but what we put in our bodies not just medication, but what we put in our bodies has a great effect on how we feel, and we just don't recognize it. We don't know that having, you know, a liter of soda every day, eventually you're really going to get sick from that. You know,
Right.
they don't make the connection, and so
Right.
it's trying to kind of really help people to understand the mechanisms that go into chronic illness in general and chronic
Yeah.
pain specifically, and to, you know, we can do things to make it better. Some examples, because you asked for some examples. I had it was a terrible place to practice, just to be honest. I was there about 5 months.
Oh, wow.
The day one, when I started, I recognized, okay, I'm gonna have to find another job. It was sort of until it was 98% of the patients were on opioids, and a lot of opioids,
Wow. Wow.
And I'm not saying, I mean, some people need it. I get that. But if you're having that much that, you know, your insurance company doesn't want to cover it because it's a dangerous amount, you know, I know people get mad at the insurance company, but the truth is you're at risk for dying with those huge doses. It's not
Yeah.
safe. And so I had a gentleman, now he was 300 pounds. He was a heavy guy, and he did garbage collection. And so he had heavy work that he had to do, and his knees were killing him. And he was on, let's see, you know, oxycodone, we talk about morphine equivalents, and oxycodone is actually twice what a morphine. So if you had 20 of morphine, or let's put it, 20 of oxycodone is equivalent to 40 of morphine, right? And the maximum you should have in a 24-hour period, maximum is 90 milliequivalents of morphine in a 24-hour period. He was on 40 oxy in the morning, 20 at noon, and 40 at night. So we're talking 100 and, right? That adds up to 40, 60, 80, 100. He was like 200. He was way over what's back. Yeah. And he was still in terrible pain. He said, "Doc, please, I need more because of the work I do. My knees are killing me." And I was like, "No, you don't need more medicine." I said, "Yes, your knees are killing you. You know, part of it is your weight, because, you know, on the knee, the way, I'm not great at physics, I'll be honest, but I do remember 4 times your weight is what, you know, your knees are absorbing when you have." So he was really under his knees were under a lot of weight. They said, if we, not to try to weight loss, but just try to eat healthy. And I put him on an anti-inflammatory diet, which is mostly fruits and vegetables, cut out red meats, cut out processed foods, drink a lot of water. He felt better. That's the one thing I gave him. And he was like, okay, you know, my pain is like 5 out of 10. I can deal with that, you know?
Yeah.
So that's just one example. I think a lot of people don't recognize the importance of stress and how stress aggravates their pain. And so you can't just talk about dealing with their pain and not talk about dealing with their stress.
Right.
You know?
Yeah.
So those are some of the things that I try to help with. And
So I'm glad you mentioned stress, because as an eye doctor, you know, people will come in with an eye issue, but the underlying issue is it's really not your eyes. It's are you stressed? You know, it's just manifesting.
Right.
It's isolated, but it's not. So so stress play a huge role in our chronic condition. And so even me, I find myself a lot of time, you know, we talk a lot about, you know, what's good for the eyes, doc. So I have a lot of patients who ask me, well, what can I take for my eyes? So my standard answer most of the time is, whatever you take for your heart goes right to your eyes.
Exactly. I totally agree with that.
Yeah,
I totally agree with that.
Yeah, if you're eating fatty foods, it goes right there. If you whatever the good things you do for your heart, you're also doing the same good thing for your eyes.
And it's such an unfortunate thing, because they like to talk about heart healthy diet, but if people don't feel like they say, oh, my heart's fine, they don't register that as something that they need. right? Because they think they have a healthy heart, when it should just be it's a body healthy diet. It's not just for the heart, it's for
Right.
it's for the
Right.
whole person. But
Right.
yeah,
Yeah.
got such a
So what about diabetes, which is like a very common condition? Do you see folks that have chronic pain from
yes.
diabetes, and what are some of the techniques that that you would use to help them with, from diet, exercise? You know, what are some of the things that are out there
Right,
that you use to
right.
help?
Yeah. Diabetes is a great contributor of pain. First of all, just having diabetes, their arthritis can get accelerated. They have worse arthritis in the setting of diabetes. And then there's the diabetic neuropathy. If anybody's had diabetes 10
Yes.
years or more, that can be very, very painful, usually in their, limbs, their legs. There's different types of diabetic neuropathy as well. So that's another story. But so in addition to diet, exercise, I believe in food as medicine and exercise as medicine. And even just walking, just simply walking, 30-minute walk a day will make a difference. They help with their metabolism, help them to generate insulin. And you know what? It's interesting. The time of day that you eat can make a difference. What you eat and the time of day you eat can make a difference. For
Interesting.
instance, they say you should, in the morning eat like a king, and then at noon eat like a nobleman, and at night eat like a pauper. So you want to eat your more food in the morning, a
Right.
little less at noon, the least at night, because at night, hopefully you're going to bed after that, and you don't want to go to bed on all that food. All of that food is supposed to be our source of energy, our fuel.
Right.
But if you don't use it as fuel, it gets converted to fat. So you don't want that. So so the time of day is important. What you eat is important. Time of day that you exercise can make a difference as well, which I'm learning. There's studies that show. There's a study that shows that just exercising for 10 minutes 3 times a day after a meal was more effective at lowering blood sugar than walking a longer period of time once a day. Which is really interesting, right? The other thing is lowering blood sugar and blood pressure was better if you walk in the morning on an empty stomach. Wow. Why that is, I'm not sure, but if people can do that, it can make a difference. It can make a significant difference. So getting out and exercising. Some people say, "Well, I can't walk. I'm in too much pain." So I get that. But if you can just do 5 minutes, in your house, just 5 minutes until 5 minutes gets comfortable, where you could go to 10.
Right.
Because our bodies need to move, and it's kind of it's almost like a catch-22, because moving is going to help you feel better, but you have to go through the process of it hurting at first. Just push yourself a little bit, because our bodies need to move. And it's there's a book I read a couple years ago. I'm still trying to implement it. It's called Younger Next Year. It has nothing to do with, I didn't read it. I read it for myself. I didn't read it as a physician. Younger Next Year, basically these people that really go gung-ho with exercise, and to where, they're up in their 80s and 90s, but they're 20-year-olds, because they exercise. Because the body, prehistorically, you think about primitively, if you don't move in the prime years, we're talking, hundreds and hundreds and hundreds of years ago, everybody had work to do. Everybody was, either you were a hunter or you're a gatherer, or you're doing these things. When you can't produce, you can't move, you're dying. Those are the ones who are dying, right? And our bodies, even though we're in this modern time, our bodies are still, genetically,
it's still the same. It still have the same needs.
Yeah. And so your body thinks, when you stop moving, your body thinks, okay, well, we're gonna start aging now, because you can't move,
Right.
But when you start to move, you start generating the different biochemicals and things that go along with being alive. So it's so important, if you want to stay healthy as long as you are, still living, keep moving, keep
Yeah.
moving.
Wow.
And all the other things that are good to help, just live a healthy life. Yeah.
Absolutely. Now, Dr. Ruth, I have, as an eye specialist, I see a lot of patients with a lot of autoimmune conditions that leads to chronic pain. And sometimes when you have those autoimmune conditions, they can cause issues with your eyes, such as, iritis and retina issues. And,
Right.
then we end up putting them on eye drops continuously and all of that. And so I work with rheumatologists as well for a lot of patients who have those chronic conditions and have the chronic knee pain or neck pain and whatever pains from their condition. Are there certain diets or that you as a coach would recommend that helps with patients with chronic pain that would maybe have another tool for their in their toolbox to kind of help them in their journey?
Yeah, and well, obviously I've already mentioned anti-inflammatory, but I do think that it's helpful to see if a person has food sensitivities. It's not the same quite as a food allergy, where the anaphylactic and your throat clogs, and not quite that. But if you do an elimination diet, which usually it's kind of hard to do, not everybody can do it. Let's be honest, is you only can eat certain things, and you eat those things for like at least 21 days and clear out everything else from your system in that time, and then slowly reintroduce different food items and see, one every 3 days, and see if your body has some sort of reaction to it. Because people might find that they didn't know there was a connection with sugar and their pain, or there was a connection, say, with gluten, wheat, and their pain. But when they can slowly reintroduce them, they can see those differences. And then obviously you can't eat those foods, or at least there's a whole nother thing, which I'm not, I to be honest, I'm looking for a GI specialist to talk to about leaky gut, because that's another one. Your gut can heal, and over time, maybe you'd be able to tolerate those foods later. But, right now, your body's sick, your gut is sick, and so you need to abstain from those things that cause those symptoms.
Okay. Yeah. That's really good. One thing in my field that I find, and I'm a firm believer in using different things, different things to help you on your health journey, exercising, eating right, in addition to the medications that your doctor does. And now I like the whole idea of having a coach to kind of help you navigate through all of that, which coaching, is not a lot of people don't know or may understand that whole aspect of coaching, which I think is interesting. But one thing I found with folks, some people who have chronic condition and they are on these chronic pain medications for a long time, I find that as a surgeon, when I am doing surgery on them, their pain threshold, or the threshold that it takes, the amount of anesthesia I guess I have to give to my patients sometimes is a little bit higher,
Right.
sometimes a lot higher than
Right.
to get them to relax
Right.
versus someone who's not been on chronic pain
Yeah.
meds.
Yeah.
Are you able to kind of speak a little bit to that?
Yeah. So that's why I'm really not a fan of opioids. I'll be honest. I think obviously post-op you need it, after surgery you need it, intermittently you may need it, but chronically, I know there's plenty of experts and people who are more experienced than me that will say it's fine, but there are a lot of side effects. There's a lot of problems. It's not just about overdose. It's not just about addiction. These meds actually change the structure of your brain. All right. so that you become even more, the pain itself can do this. Your pain can sort of get to where there's a, I'm trying to put it in more simple terms, spiraled, where certain circuits are constantly being activated. These meds actually pour fire on that. They increase that. So that instead of it being something where it's fighting your pain, yes, you have a brief relief of pain, but it's also activating those same circuitry so that eventually it won't relieve your pain. That same dose stops working. It stops working because your brain is slowly being changed to become more hyperalgesic. You're getting more pain because of how these meds work.
Wow.
And so then that's the thing. They say, oh, it's not working anymore for me. And the doctor doesn't recognize what's going on, and they just increase the dose. Eventually that dose is not going to work anymore either, because it's slowly changing your brain to become hyperalgia, like having more sensitivity to pain. You have even more and more sensitivity to pain. And, sometimes you'll see a patient and you just barely touch them. It wasn't even a painful touch, and they're jumping off the table, and you think, oh my gosh, yes, this is a drama queen, right? And they're not.
I'm
it's
asking
really
my anesthesiologist, did you give them enough? Like, what's going on?
Yeah.
I don't need because Joe's moving that much. So
they think it looks like it's an dramatization when it's actually a result of the opioids, the chronic opioid use. Yeah. So that I would definitely call that opioid use disorder. There's medications like Suboxone if they're, still want the pain relief, but, to keep them safe, because it's got the buprenorphine and the naltrexone, which is, gonna not make them high, just make them stable. So, those are some other things that could be done for that situation. But yeah, like I said, I'm not for it. The other thing too, you're predisposed to dementia with chronic opioid use. There's personality changes people talk about with chronic opioid use. The patient might not notice, but their family say, yeah, he's irritable. Well, it goes with those things.
Wow.
Yeah.
Well, Dr. Ruth, thank you so much for coming on. You just really educated us on some of these things that, when you're dealing with chronic pain, there's a lot that goes into it. And, my heart's desire is for everyone to really live as healthy as you can, and using all of the tools that we have to help you on that journey. So I am so happy to see what you're doing to help people who are living with chronic pain and whatever that source of pain is. And it's so good to see that someone can come in your corner and kind of help coach you through that, give you ideas, help you, educate you on what other resources are available. We didn't even touch on supplements and other things that be helpful. We may need to come back and kind of talk about that another time. But I just truly, truly appreciate you coming on. So if someone is suffering from chronic pain, they've tried multiple things, or just want to know what's out there, or is really interested and say, hey, I want to coach. I'd like to know how to, how I can navigate this pain situation and try to live my life to the max and not let this take over my life. How can they find you? Please let them know.
Yes, surely. So yeah, this is for anybody that wants to take back control of their life and not having pain control them. Absolutely. So my website is www.chronicpainrescue.com. You can email us at info@chronicpainrescue.com. And as I said, by the end of the month, I will be seeing clients online. So anywhere in the world that you are, I'd be glad to work with you. Really, really would be honored to help anybody that would want to come and work with me. And we'll see them get their health back and get their life back.
That sounds really good. So I'll put all your information on the show notes and all of that. And so if anybody need to reach out to Dr. Ruth to find out more of how she helps you with your chronic pain, how you can be rescued. I love the name Chronic Pain Rescue. And so thanks again for coming on. I really appreciate you being my first interview on our platform.
All right. Thank you so much for having me. It was a
Yes,
lot of fun. Yeah.
yes, no problem. So we'll talk soon. Thanks again for coming.
Okay, great.
And if you're watching this and this has been helpful to you, and you know there's someone who could use this information, please share this video. And if you happen to be in the Baton Rouge, Louisiana center area, Baton Rouge, Louisiana area, and you're looking for an eye doctor, please check us out at Louisiana Center for Eyes, www.lacenterforeyes.com. And I will see you next time. Thanks again.